our weekly town hall regarding COVID-19. Na ihe het hit shniro leshik ero shidne aro kodo e citizen lini be a nail I aro han linin hit nail I ko ba ihe needs in ade hada so gizi kodo shay to na deals dole. Kodo hojo dole shamana Hassan yadil Zlistan twistan Charles hier hayol kas no de tui halt elchi halt ewan kada dint anisa anarabik e hojon ni yajin e wait ni long kon ntanadi zindi beni biye de quina haye da she kwa de quest nast eight at dapedi no kwa ni ya ilni ado kon nit tedi zin kon hit to de zin hanahilla ni hit adol don hit alto dole a kuije e kodo so de zin chamana san lini di in de da no lini kon ado kon hil ga hot so de nebel ga hot so ba ka o kon ni hit de ne dan lini ni ras twin hizani dan lini betayana da hot e dole rajin so go kon de kos nas it at dapedi ni it's anhinnel ado Adam de hilas edados ni dan hit no da kon yin ni lo chena yin hinel do beledi ka ado nas go net ne kana ni do ini zindo hena ilti do ini zindo kon an ni tedilzi ni hit so de zin hata de yin in sindole ni hit ni yin do hata de yin in hin sindole e jashi ni he otla as a dat end so de zin edo do be we need era kon ya at ero e nadi katon ne na ne de to le hiena il ni to le ara kon hide net dan lini kon ya at ero but nada has ado le kon be kon da del tip be honesh kishna skango be gam has ango be na kloshin da ke kon ya at ero na has ado le ada alla large de nishin hits a long lini kon de sesa dan lini ada kon ze in is it ne ka dan lini ko ya at eko but nada has adole bit up ba dan chi in holla ko ba ma be je ko be ke dan lini his kadaj je ba chine bit so ke ben na leke at ende benashni dole but it so des in lini ho be nana si dole adon hi nat ani dan lini ho it's a de nat ani adon hi besh has an tat nas nile sine he street be da bet ochini als ho benashni dole ado is el bit has ango na has twin hizani na zava khatas entas tion hi chete has kedole konsaga etso de zinlini be nana si ole konjo kon hit na host atole hojana hasli hojana hasli hojana hasli hojana hasli. Thank you. At this time, we appreciate you tuning in to our town hall. Ado Kodoshe, Sitzilin, Lini Konsula de Natani, Linin Hichahanana Zitole, Ado Janda Aldehido Yat El Kon, Nadi Kedole Kon, Ado Ike Bij the Nadi Kekon, the Haskindon, that the Chich Nahui Shish, Koyat Ekon Hilas Adole. At this time, we'd like to turn the floor over to our president. President Jonathan Nez, Shatila, you have the floor. Eshi Aje, Hanat, or Gis Ajin, Hinat Ani, Lini Ainle, I got or Ade Shin Hitchem Hadodne, Ado, Kodo Eight Hodilzen Ko. At this time, we'd like to give the time to President Jonathan Nez. You have the floor, Shatila.
كه ونزت الكينا جونا بشندين بهوت إني كإني داتجيني إن داتلهنا بأو بهوت إني بإنا إني بون كونتنا هون كونشتشون إشكيش بين بنزلا بين هونشي يادي كه إن ده هون تودي إني توصل نشين توبياج بين هتخدا هذا تلي بهون ده الخاص ده هون بتشيادا زيادة جنوب ناسانين كاتودي يكونش منو سامك هاي تصل الآن كني تبيد آده نادا إلتينو خانا له وشيارو تودي جهنا بجاوه هون أزال الآن كني تزان خالش ني ساكن نادك بيني تي بيني دا إنت لا تنحب كهدا هادون إلتيجي أشياء كوني جنو ناسامك هاي كيف الآن كني تزان دا هون ده ناشي دان بين دا سوني تشاجو هينسن أرو تهجو هون جنو دا دي إلتيجي بنجي بان دادون also كده هادون مودن هذا عشيا وجونا هذا تين صادش شكله شتى ياك شكيش نابليس زاديس أنا هيك عشان دوت كده نهي تاني تلون دليل نسا أنا هيك عشان دوت كده نهي تلون نشاطش وجونا أصلي وجونا أصلي وجونا أصلي وجونا أصلي thank you
كيهو شنالة زنو صد سندو صد زن بين خاهنتي. Okay, now let's go ahead and have our prestigious visitors and our CEO have a seat over here. Go could it doesn't be after. President Nance, can I have a seat, please? Helen Stafford, Virgil, Ford, Go could it not be. Harun the Hadadi, last name, find a chair and have a seat. Welcome to Winslow Healthcare Zone. Employee wellness. This is one of the best things that we could do for ourselves. We'll be participating in all these events today. So let me turn the mic over to our CEO, Ms. Sally Pete.
Good morning. Good morning to each and every one of you, and thank you for coming. This is like said, this is our special day. This is for you to make sure that you're well while you're working with us. Make sure that you go through the line and whatever the setups are, making sure that you are checked if you have anything that you want to know about yourself. Just make sure that you're well and while you're working with us. And please take care of yourself every day, every single day. And I want to also thank everyone for being who you are and always coming to work and helping us make this organization one of the best on the Navajo Nation. And this morning from the Navajo Nation President's Office, we have Honorable Jonathan Nez that came to see us this morning. I really appreciate that. Sally Peak, Nakaidanan, Shno Todicini, Bashin, Ado Hachin, Shichedo, Ashinta Shinale, Ado. I'm originally from Red Valley, Arizona, just over the mountain from Dugachiga, Arizona. So I'm been with the organization for over 20 years. And there's a lot of changes that took place over the last 20 years. So I appreciate each and every one of you and making some changes, progressing into so much more, especially when we move to Delcom Medical Center. To each one of you. I want to introduce Shanale Honorable Jonathan Ness. I am surprised that he's actually came. I don't know when he got up, but he's here. Came before he was here already when we got to work. So I am so happy that he's here. He is such a wonderful person, and he's gone through so much with all of us here in mitigating and helping our people mitigating COVID-19 when he first started back in March 2020. And it's been so long, but he has done a wonderful job in helping us with where we are right now. Thank you, Chanel. I really appreciate your staff. Yeah.
Well, good morning, everybody. Give Sally a big round of applause. It's good to be with you all today for the Winslow Indian Healthcare Corporation's Employee Wellness Event. And we're also on the town hall. Remember, every Tuesday at what time? 10 a.m. We do our town hall for updates for COVID-19 and now monkeypox. So you are going live all across the Navajo Nation, all over the world. So if you want to pan that way there a little bit, Jared, and if you guys want to say hi to everybody, Navajo Nation wide, World Wide Web. So yeah, then you need this. They're some are a little shy, but we appreciate them. Employees, staff, faculty, give yourselves a big round of applause. You know, you've done an outstanding job. Winslow Indian Healthcare, all over the Navajo Nation, all over the country, our healthcare workers have been on the front lines. I remember being here many times with each and every one of you, right? We were handing out food, we were handing out masks, PPEs, and especially during that uncertain times, it was pretty scary, wasn't it? There was no vaccine. And now that we have a vaccine, we have been encouraging our Navajo people to get their shots. So we encourage everybody to get their shots that are listening on the call, and flu shots too are going to be available throughout in and around the Navajo Nation. So kudo Shane Slino Tutnesani Bashin Tudachini Dashichedo Tachini Dashanana. And for the board of directors and for the administration team, you know, we appreciate the hard work that each and every one of you have done for our Navajo people. You know, and for those that are on the World Wide Web watching on the town hall, you know, we have seen a decrease in cases all across the country. And, you know, with the fairs happening, with Chinle, Window Rock, and just this past weekend, Shiprock, Northern Navajo Fair, you know, everybody that I saw out there have been following the protocols, you know, be it wearing masks, using hand sanitizers, social distancing, and now with the new virus out there, monkeypox, we still today have only 4 confirmed cases on the Navajo Nation. So we thank the Lord for, you know, really holding that virus back here on the Navajo Nation. So we just gotta keep moving forward. Daisono tsagi here di kontigo ni keni na monkeypox with the doors na konda hadai no ni master das do di just next serigi ya just to it next serigi and hilla beda tsagi here na jogata edi dikje na nesh kosin tsagi na has it's da do monkeypox da tagi do Auto Club and yeah,asi Glengi Yakon Winslow Indian Healthcare J Ajin Daj Neshigi Kombaho Tsispa no Kon di Jibaho do here Nakapedini do left kuja Winslow Indian Healthcare kuja Chadas Inigi kuja to Southwest here na do Delcon Medical Center do Ishido Alne to Leslie Del Conde, so Ishido Baheni, Zendo Sashigo, Aden Dalnes to Leslie Kane, Hinenhachin, Ebahajo. Aro DJ Le Sage Memorial Hospital, Godo, de Credo Alne Hatno, Ishido, Aj Nidigi Zel in Nita. So Bahele, Hon Benache, Kon Halchin, Akon Keda Atido, there's the Akon Dalnes to Leslie. And with everybody being here, we want to let you all know to enjoy the time here. And on behalf of the Navajo people, Winslow Indian Healthcare team, warriors and lady warriors, thank you so much on behalf of the Navajo people. I know you probably hear that a lot, maybe sometimes not enough. But your leader, your president, does appreciate the hard work that you have all done for these over 2 years of pushing back on COVID-19. And today, why this is being put on is that you all kind of focus on your patients and others, right? But today, we want you to focus on yourself as well. Go and get your vitals checked, get some more information, and just have this as a day to focus on yourself today. And sometimes we forget about ourselves, right? And we don't put enough time for ourselves. So thank you so much, all the service providers that are here, Navajo County. I know I saw Alberto Peshagay here as well, and many others, Winslow Police Department, Grand Canyon University, Noland Pioneer, everyone that's here. We appreciate you all coming out. So I'm going to turn time back over uh, to Virgil. Let's get Virgil here. Everybody knows Virgil on the World Wide Web because he's been representing the 638 facility. 638s are like Winslow, Indian Healthcare, and also Tuba City Regional Healthcare, at times Utah Navajo Health Systems, and partnership. That's why we're able to turn it around here on the Navajo Nation, pushing back on COVID. So we appreciate Virgil for always being a part of these discussions. I'm gonna put him on the spot here today. Virgil, help us out on the town hall as well. So thank you so much. God bless you, everybody. Take care.
Thank you, President Ned. Yate Butcher Al Davis and Kiss Ani and Shank Topaha Bashishi, Kima Dashi Do Touching the. Thank you, President Ned. With regards to COVID 638 activities, the 638 organization is comprised of 8 facilities, 4 in Arizona, 1 in Utah, and 3 in New Mexico. So we move forward as a strong healthcare delivery system along with the Indian Health Service as well as our urban program in Flagstaff, Arizona. Just wanted to say that as part of the 630 organization, Winslow Indian Healthcare what celebrated its 20th anniversary as a 630 organization on September 1st, 2022. So we became the first 638 organization in for the Navajo Nation, September 1st, 2002, which is really a significant milestone for the Navajo Nation as well as for the 638 Association. And we are part of the southwest portion of the Navajo Nation. As President Nez communicated earlier, we are looking forward to opening the new Delcon Medical Center, which will be located in Delcon, Arizona. So again, a lot of information. We, as the 630 organization, continue with our vaccine campaigns for COVID. So if you have yet to receive your COVID vaccine as well as your boosters, come to the different 638 facilities as well as IHS to receive your boosters for COVID. We're still awaiting the vaccines for flu. So when those arrive, we'll be giving our flu shots. And again, our flu campaign and our COVID campaigns will be going on simultaneously currently as well as until we run out of vaccines. So again, please come out and bring your family. Today, we're here at Winslow Indian Healthcare celebrating the employee health and wellness activity. So we want to make sure that our frontline workers for Winslow are taken care of, meaning that they take care of themselves so that they too can enjoy their quality of life without the stressors that go on daily by taking care of our patients. But we want to also make sure that our staff workers are also aware that they do have
that time to take care of themselves in terms of health and wellness. So we want to make sure that they continue doing that for themselves every day. So with that, I just want to say thank you to everybody and those that are around us. Just want to also say that as part of my co-leadership, I work closely with Chris Hurley, who is the 638 Association president. So he and I represent the 638 organizations on the town hall calls, as well as the unified command system. So again, we do a lot of information sharing, but we also want to make sure that we communicate what the 638s are doing on the Navajo. So again, appreciate that. We also want to make sure that we keep moving forward in combating COVID the best that we can by communicating with our partners through the Navajo Nation and Indian Health Service. So again, a lot of those activities are simultaneously being done and communicated daily. So thank you, appreciate it. So with that, I'll go ahead and yield this over to Al.
All right, ladies and gentlemen, we're here live, Winslow,
Thank
Arizona.
you, Mr. Davis.
Back to you back in Window Rock, Dr. Jill Jim. Thank you so much.
Hey, thank you very much, President, and Ike, for your ongoing kind words, and also visiting the Winslow Indian Health Center's employee recognition and appreciation day. It's always good to recognize our frontline workers, and also probably finally trying to do sort of like a potluck or serving food, and it's always nice to get out and celebrate the success of employees across the Navajo Nation as well. So Ike for visiting the Winslow Indian Health Center in Winslow, Arizona. I am Dr. Jill Jim. I'm the Executive Director for Navajo Department of Health, and Don na in the Shinde look at National Tachini Bashes Chindo Ishe the Shite Dog Zaflane the Shanella Adona on the Aisi Nashaf. And I just wanted to share with everyone the ongoing messages around the COVID-19 efforts. We still meet as a group with the Unified Command Group every single week, even though probably some states and federal agencies maybe have demobilized their efforts. But here on the Navajo Nation, we have a group that's still intact, and we meet and discuss the priorities to address COVID-19. And also with the teams, they're still intact and reporting, and health facilities are still reporting information as well. So just to let everyone know, these town halls are very important in that way. While everyone else has lifted a lot of the restrictions months ago, on the Navajo Nation, we still have certain mandates, and we hope that people follow them, because the COVID-19 is certainly not entirely over, and we're sort of transitioning into a new phase each time, and now we have the flu season and also just other variants that are always going to be talked about. And our surveillance team is still sampling COVID-19 tests from all the health facilities, or most of the health facilities, I should say, not all, and sampling some of these COVID-19 test results and for different strains. So that's why it's important when we do the report that there are information about having BA.4 and BA.5 being more prevalent around this time, and then other variants are certainly a threat, and I'm glad we do have our surveillance system to detect that. And also just looking at the mandates, I mean, we have another fair that's coming up, and as there are more gathering opportunities in the public, we hope that people still take the precaution as best as they can, because people are still getting sick as well. So, and having preventive measures individually still. So when you're out and about at the fair or events, please look at please continue to carry a hand sanitizer, and also just a hygiene kit with you at the fair, because sometimes it's not really accessible having those around. But we hope that the vendors do their best in keeping everyone safe. But it also would be good to be prepared individually to make sure you have all of the additional masks. I know we had health stations at all all fairs, our CXRs and health educators are out there providing information about monkeypox, things that are sort of at threat right now, like hantavirus with all the rain, and then our ongoing COVID-19 prevention. So if you see a health station at the fair, there are masks, there are COVID-19 test kits as well, and pick those up if you feel like you want to test yourself and be safe. And sometimes we do the best that we can with our mask efforts, and then it will be very important if you are in a confined area to wear a better quality mask. Right now, the mask that I'm wearing is more of a disposable surgical mask. You might want to have a KN95 or an N95, which our staff will carry with them at the fairs. And so you can pick that up, and they usually provide education on that as well. And now that we're talking about sort of these mandates, I know we have gathering limits that are still out there, but we hope people will follow it the best that they can. But I know that we are not seeing a high spike in cases, so we may issue out a new order this week or next week or in the coming weeks regarding lifting of the outdoor mask mandate, but keeping the indoor mask mandate. And so just look for some information. But if you are sick, and we also have new isolation and quarantine guidelines too. So if you're not aware of that, on the Department of Health, you'll see new isolation, but no quarantine guidelines. So I think you're going to have to sort of be familiar with the new guidelines, because it will show different guidelines. So we ask all the hospitals to continue to work with us in complying with these new guidelines. So if I could just pull that up and share with you what that looks like. It is a new, there is no quarantine. And so if you look at it, it says guidelines for COVID-19 cases and contacts for the general public and schools. So there's individuals were recently asked to quarantine if they were considered a close contact, and that's no longer the case. And so our previous isolation and quarantine guideline also had information about if you were up to date on your vaccines or not, so that it's not the case regardless of your vaccine status. This applies to everybody. And so, and these are similar to the CDC guidelines that were adopted a couple of weeks ago as well. With the CDC guidelines, it is similar. How it's slightly different is that we ask people to wear their mask even though for the full 10 days afterwards, if you have tested and you're getting better after the 5th day. And so you were asking individuals to continue to wear their mask. And so just a slight differences, and then also contacts who have been exposed to someone with COVID. We just ask they monitor and mask and monitor. It doesn't talk about quarantining, meaning like I'm staying away from individuals, and then asking individuals to test on day 6 as well and monitor for symptoms. So these are new guidelines as for individuals, and then we have some guidelines for high-risk individuals and settings as well. And so these are just items that we are continually working on behind the scenes to make sure that we are encouraging everyone to be familiar with that. And if businesses and schools are out there, if you could update your guidelines regarding the new isolation information, that would be helpful as well, just to encourage everyone to sort of be on the same page and receiving the same guidance as well. So we'll look forward to continuing to provide new information to everyone, but I know we do have a short time here on the town hall, but I wanted to go ahead and introduce Del with our EPI team, and he'll talk about a lot of the stuff that I mentioned, monitoring cases and deaths and hospitalizations and where we're at with COVID-19. So thank you for listening today, and be safe at the fair. So go ahead and take it away, Del.
Okay. Thank you, Dr. Ju. Hi, everyone. Thank you all for joining us. My name is Del. I'm with the Navajo Epidemiology Center and also with our Navajo XCOC COVID epidemiology team. I'm going to go over our latest numbers here for time period September 23rd to the 29th. It's a 7-day time period. But first, I want to acknowledge our epidemiology team for COVID. We have a large epi team helping us with surveil COVID cases on the nation. Our own team from Navajo Epicenter, Navajo Department of Health, IHS, the THOs, the 638 facilities on the nation. We also have some folks helping us from CDC and the CDC Foundation, and also Hopkins Center for American Indian Health, or Indigenous Health now. They changed their name, formerly Center for American Indian Health, and also Community Outreach and Patient Empowerment. They also go by COPE. And then also Translational Genomics, TGen, from the Flagstaff campus, helping us with the COVID strain surveillance. And last but not least, our state partners from state departments of health from Arizona, New Mexico, and Utah. So we are a large epi team working on COVID surveillance on the nation. So just wanted to recognize them and acknowledge them for all their support and help. This is our recent cases and trends, 60-day time window going back to August 1st through September 29th. So you can see our numbers continue to vary quite a bit every day, the blue bars, but the 9-day weighted moving average, which is the orange line, give you a better sense of the trend, continues to go down, which is a good sign. We have 3 core metrics here. Our 7-day case rate is at 215 cases per 100,000 people. This went down, I think it was 249 cases last week. So this continues to go down as well, so it's a good sign. Percent staff beds occupied by COVID patients is at 2.3%, which is at medium risk. And then hospital admission rate per 100,000 people is at 0.65. Admissions, again, this is medium risk. Nationally, this is at about, across the US, for all ages, is at about 1.0 admissions per 100,000 people. So we are below that, so it's also a good thing for us. And then some supplemental metrics here. There were 340 new cases over a 7-day period, which was a minus 37% change from last week. Again, a good sign. 7-day lab-based test positivity is at 11%. And this is just lab-based testing at all the facilities on Navajo Nation. So this percentage continues to go down as well. Hospital capacity for bed occupancy for regular hospital beds is at 55%. ICU beds at 59%. Our threshold for this is at 80%. So we are below the 80% threshold. So a good sign for us. Vaccine coverage on the nation. There's some new definitions, or a new definition that came out mainly because of the latest booster that became available for ages 12 years and older. So these numbers, especially the 6% number, changed. So 69.5% have completed the primary series, which is the first 2 doses of the vaccine, and then 6% are up to date. This is with the new definition per CDC. This is the latest COVID booster, the bivalent booster, which is the Omicron 4 and 5 bivalent COVID booster vaccine. So we went back down to 6% because this just became available a couple of weeks ago. So this 6% will continue to go up as more people get the new booster shots. So, and then Navajo, our strain surveillance, we've currently detected all of the, the Omicron sublineages on the nation through our COVID strain surveillance. And then here's just some numbers. Navajo Nation residents completing the primary series is about 129,917 Navajo Nation residents have received the primary series. Those who are up to date are at 11,303. So this numbers continue to go up, and the vaccinations continue to occur throughout the nation at all the facilities. These are the two epi curves for Navajo Nation in orange, and then the U.S. in blue. Throughout the pandemic, we are, as I mentioned, on this downward trend. Again, a good sign as well as across the U.S. The 7-day case rate for Navajo Nation here in yellow, we are first. I mean, we are seeing a decrease in cases, but really the cases that we're seeing still very high for us at 215 cases per 100,000 people. So we are first compared to the 50 states. These red bars down here are neighboring states, Colorado, New Mexico, Utah, and Arizona. So 7-day case rates across the country. Within our region, the Southwest region, there's Utah, Colorado, New Mexico, and this little darker shaded green color with the higher 7-day case rates than Arizona with the lighter shaded color here. And then as far as community transmission, within our region, all the counties within Navajo Nation, Coconino County and Navajo County in Arizona are in orange, meaning substantial COVID transmission. All of the other counties within Navajo Nation are red, meaning high COVID transmission for Apache County, McKinley County, San Juan County in New Mexico, and then San Juan County in Utah are all red. COVID strain surveillance report 67 here. This was last about a week and a half ago. The real highlight here is just the BA5 Omicron sublineage continues to increase here. It went from 433 to 496 cases detected on the nation. So the BA5 is really currently the predominant variant on Navajo Nation, and it's also the case across the US. Here's just the upper chart. Here is all the facilities across Navajo continue to participate in this strain surveillance. And then the bottom one is the Omicron sublineages here. As I mentioned, the BA5. This top row is really currently the predominant variant across the Navajo Nation. And then across the US, the CDC variant profile. And as I mentioned, the BA5 Omicron sublineage is the predominant variant across the country, making up about 81% of all variants. And last, the high-risk chapter list here. There were 25 new chapters that made the list here in the green column. And then if you go back or go across to the right, we go back in time all the way back to 6 weeks, which is this red column here. There are 12 chapters. These 12 chapters have been on this list for at least the past 6 weeks. And the number of chapters making this list continues to decrease as well. So that's also a good sign for us. We'll just continue to monitor our COVID situation going forward. So that's our update today. I'm going to hand it over to Shamal. Dr. Fowler, please take it away. Thank you.
Yeah, she has kodo ben hil na sin le not ni not kaje ko ado kodon in hinat ani lini en le basin le dra Winslow de holia aden shen kodo hazil tsi do aden en hitre kan ananalia kon hinat ani eno oshi hastro it ado le nasko so kosto nasko ne neje akon de monkey parts or yeni ge at aje nihil hanana ni konda ati ya patadol na ko aging to kodon his adulto aro aje etalate zail in benat lini nihima Sally Pete aro shiyaj Virgil Davis ado hihebidi ni do le aje it's a lunge de nishi o hayu is it enido is it ni ka aro adal enido chiya da de ni jo zel ion dal nishi at en not so it kit de in the lean de jo kajin to go kwa be het all the employee appreciation ne aro AD bits is jo na nish jotra op hat is lini ape ahwa be eta ahwa jiliano be eta ahwa zini jo klato be baba ahe ni zin hala o you go she ni hinne de la do ni jada la hoda nes ka go la di de kosnas it's at da nini o kolante John de nishin dal nishin lini e ba he winzen je edi basin el jot aban alte Aron hinat ani en di aje belgas anje Delcom Medical Center Ado Sage Memorial Hospital aje do adar ne do ne do aje shi e kodo ban na hat indo le aje do ba he nitzen is in adar na ido ni hit ne e ba it in jo ta e kodo hinat ani ye hatzi Ado kodo is it ben up in Iliai gidi because nas it's at dapadi nini jo aj do hashin to go is it in lini na hatar ne jon ya non ho ka Ado kodo shi and lini do din dal nishi ala lanj de nishi eda ba heta nitzen a kuije jo di hashin to go behes ani lini hanada del ne akonde di nas ni atin jikish ado the kos Tini tota atani gata ajda pastol ta. Jo konda an hebe ta hosian ko na hoche besda huit adok at ane sa besna holjes edi tonanes dizje o kondo ya go dich ostoit ini ben na sedi an asan da jacoben da ostlahan jonne ano dini hitchidon hize abata da des balon da ke edo hehe konde osho hotedo le hago de yashi be eta ako jiliado le aro di be et ode da anji ja jo saho be eta den ko ishi o be eta ako lia aro di hanto virus da ne jo eda nas ni de kostan das ni yil na gani don hil be da hosen da ena be eta ako lia aro di haslan go da be eta ako lia an ni edo ya gondes kinde jo beta ahayani e ara behes ani kodo ya hodne isolation guideline with yetsena a quarantine that oliene jo ad quarantine at papa na chwalia de isolation gauge la jidon lenes na jije jo hot aya na hasne ana na kunne ad is el ebel na has ango at ende activik edeni in beta na idon das nihi Ara di kan nas in lebel nas angol ni hit de nebel gehaut so beke ya hodro eat en activik esidit e non hit ona Ara di shiyaj ya hol na edi nas ni nal kaidi benit anso na dino atra yo kato na dino anast e yo kase jo edi di jimpa na egi edi kodo yinda lishin da alkahi e kodo inna yana hol ato he di ni ako yagoil kil e yagoil kil akonde ditos e jije e na kidnes atino ashla ata akone la e betador na konde tesk efel nas ango di supplemental matrices nido core matrices ninigi jo e na kahi be e hosen akodin hil kahot zoge tadnes atino atestin akone la she betador na akonde tos jije di ahon waje home test kit agenda kahi gi Alla a beso be what kai alla a dot is doba aro di e ya is it ben up ben bahata ya gi di as kan ya do sni to beso be what ka kunnen zago kit kunde is it na hata ya ge primary series ada tsna kill na hata sigi e alla de Nezatino anatino anas edemilias doba anas etino as tutsata akon art ende kapustu dan hata ya alla tlata demilias doba kad nezatino atra akonosla aids is lini a kit na non na hata ya akon de dish latin haut zoje di yo toja hos dojidon le ishinpi tojo de bensa e yego yago kit akon de ni de nebel haut zoge na one nation at di wotakte na kit akon de din harchinin hi yajin hi away in lini is it lini bahata liage by billion ne na kitata to tekopeda heki kapahalo Ado manu valiant lini booster extra banach don le that ada bahalo akodi the cosnas eight at that laho and ordinarily sus dino ash la go ni hits up the nades kit ko at and the variant lini na kidin the media jo anas ednes atin anas etino atin ado di landa atleko tratna zin las ango ajo yago kit edo ba ke ni zin jono shin kodo bel ba achil da has net do ben a chi not kini e ich het ni do le e do ne a ko hasto it aro le ko do a kuije as that the modo na kis kanjet ni ben hil na hui ne da khwasia a do ha ishi ini do ben na tsediki jo edi chos in hit di ne a do scha des es ni hit anas chego huinosen le haslago e ati ni chidon hize betat des balo nacha Wanna egi nasho o yubel dash edo abenacha dik adobena shain asahuna satana but a edopto bena shada ko yego shi beta ko lian shi edo shidne ado hago dasudo yaj asudo yago da naho bez ani laho ya andalia ado laho ek at ado bena hatan hitne akonda ashin hibeta akolia Osh yo sahoto ta nigo o tan stil ratos del kosa. Adon hitrahanes gegot kosa da aho ma so dajo na khayat adon na nishin na lini ni hido hajon hidne en lini belchi ya tke ado be na hinot hin ado be ha shokke do khaladina antkini it elto jono on ado ot ehda Okohon Sagoshin Kodon Hichahana da si dole Ado Yat Ekunjuno Kon Heda o Ado Di Raj E Kadon hid the Nenny Lini E Kuna Eya Nihen Nada Eba Henitzen Aj E Raj Le Ike Ejabita Nadi Kaiba Henitzen Okoye Goshi Beta Atahosyado Kon Dahon Ahale Etim Bakago Ado yasto tinda kon et chidin lini do apen se kes dan hit ni de ko beta ko lia hajo chol ido hajo bena khado bena te wat a e kodon hit nana si do le shik edo shne kon to do le do na he ha kon